How can you avoid Medicare late enrollment penalties? Have you ever wondered how to steer clear of those pesky Medicare late enrollment penalties? It's a common concern for many seniors. Let's break down the steps you can take to avoid these costs and ensure you have the coverage you need. First, it's essential to enroll in Medicare Parts A and B during your initial enrollment period. This period begins 3 months before your 65th birthday, includes the month you turn 65, and ends 3 months after that month. If you sign up during this window, you won't face any penalties that could raise your monthly premiums permanently. For Medicare Part A, most individuals qualify for premium-free coverage if they or their spouse paid Medicare taxes while working. However, if you do have to pay a premium and delay your enrollment without qualifying for a special enrollment period, you could see a 10% increase in your premium for twice the number of years you delayed. To avoid this, enroll as soon as you are eligible or if you qualify for a special enrollment period, such as if you are continuing employer coverage after age 65. Now, let's talk about Medicare Part B. You need to enroll during your initial enrollment period to avoid a late enrollment penalty. This penalty adds 10% to your monthly premium for each full 12-month period you delay. This penalty lasts as long as you have Part B coverage. If you are still working and have coverage through an employer group health plan, you might qualify for a special enrollment period to delay Part B without penalty. Just remember, once that employer coverage ends, you must enroll within 8 months to avoid penalties. Medicare Part D, which covers prescription drugs, also has late enrollment penalties. If you go 63 days or more without creditable drug coverage, you will face a penalty. This penalty is 1% of the national base beneficiary premium for each month you delayed. It gets added to your monthly premium for as long as you have Part D. To avoid this, enroll in Part D when you are first eligible or maintain creditable drug coverage through an employer or another plan. Medicare Advantage, also known as Part C, does not have a late enrollment penalty. However, you must be enrolled in both Parts A and B to join. Medigap, or Medicare Supplement Insurance, does not have a formal penalty, but delaying enrollment beyond your Medigap open enrollment period may lead to higher premiums or denial of coverage. This open enrollment period starts when you turn 65 and enroll in Part B. To recap, here are the best ways to avoid Medicare late enrollment penalties. Enroll during your initial enrollment period around your 65th birthday. Use the special enrollment period if you have employer coverage. Maintain credible prescription drug coverage to avoid Part D penalties. And enroll in Medigap during your open enrollment period to avoid higher costs or denial. By planning your Medicare enrollment carefully and understanding your coverage options, you can avoid costly penalties that increase your monthly premiums for years to come.